questions about this peppermint oil. I'm not too sure about it.
Okay, is it for yourself or for someone else?
Yeah, it's for me. So I saw on Dr. Oz that peppermint oil is really good for IBS, but my friend in pharmacy school told me not to always trust Dr. Oz, so I thought I'd come in and ask you some questions about it.
Yeah, for sure. Well, Dr. Oz does make some recommendations that might not be safe for everyone, so I'm glad that you're here to find out more about peppermint oil. Peppermint oil can be used for IBS, but before I do recommend it for you, I have just some questions to make sure that it's safe for you.
Okay, yeah, that'd be great.
Okay, do you have a couple minutes right now?
For sure.
Okay, so what were some of the symptoms that you were experiencing with your IBS?
Oh, that's a little embarrassing. Do you mind if we go into somewhere more private to discuss that?
No, for sure. So now that we're in a more private counseling area, I just want to introduce myself. My name's Maria and I'm the pharmacy intern here. So to get started, do you have any allergies to any medications?
No, not that I know of.
No, any herbal products?
No, I don't think I have any allergies at all.
No? Okay. Are you taking any prescription medications?
No, I'm not.
No? How about any over-the-counter medications?
Sometimes I take Tylenol occasionally when I get really bad menstrual pain.
Oh, okay. And any herbal products?
I sometimes take a multivitamin. I'm not sure if that counts.
No, that's good. I'm glad you're taking a multivitamin.
Okay.
So do you have any other medical conditions? I know you mentioned you have IBS. Do you have anything else?
Yeah, so I have IBS. I was diagnosed by the doctor about 6 to 7 months ago, and he told me I had IBS, and he told me there were different prescription items I could take, but I kind of prefer to take the more natural route, so I was pretty excited when I heard about peppermint oil from Dr. Oz.
Yeah, I bet it's not a fun condition to have, and the symptoms can be pretty hard. So can you tell me some of the symptoms that you were having?
Well, it's kind of embarrassing, but I get really explosive diarrhea, and I get lots of stomach cramping, and I find that happens primarily after I have my meals or whatnot, and this happens 2 to 3 times a week. So when the diarrhea gets really, really bad, sometimes I take some Imodium, and it helps a little bit.
Yeah. And have you experienced any significant weight loss recently?
No, I've been trying to lose weight, but unfortunately, I haven't been able to lose them.
Okay, and how about any rectal bleeding? I'm only asking because I just want to rule out some other conditions that you might be having, and I don't want to give you peppermint oil if it's not safe for you.
No, I don't think I have any rectal bleeding. That would just be blood in, like, when I poo, right?
Yeah.
Okay.
Exactly. And do you have any symptoms of your IBS at nighttime when you're sleeping?
No, it's usually just after my meals. I get lots of stomach pain and the diarrhea sometimes.
Yeah, that can be quite difficult.
Good, yeah.
Okay, and do you have any acid reflux or anything?
No.
Like that?
I think I'm pretty healthy.
Yeah? Okay, are you pregnant right now?
No.
No? Or breastfeeding?
Oh, for sure not.
No? Okay. So peppermint oil is a safe product for you. Clinical studies have indicated that it could relieve some of your stomach aches that you've been experiencing because it helps relax those muscles in your gastrointestinal tract, which will give you some relief from that pain.
Oh, that's great.
Yeah, so we have a product here. It's Weber Peppermint Oil Capsules.
Okay.
Yeah, so you take it 3 times a day, about 15 to 30 minutes before meals. Give it about 2 weeks and it should start to work at about that point. And for the full effect, it should take about 2 months. But if at that point you notice that it's not working or if your symptoms are getting worse, come back to the pharmacy or go to see your doctor because it might mean that it's not being treated with the peppermint oil or you may need something else at that point. So there are some side effects associated with peppermint oil. The most common ones are like abdominal pain, discomfort, and nausea, so it could be worsening some of the symptoms you have.
That's not good.
Yeah, so if you do experience those symptoms, then stop the medication. You could also have some heartburn as well. If you decide to take antacids, come see a pharmacist about it because there is some interactions with peppermint oil and antacids, so that's something we can discuss if you do decide to use an antacid. Some people have had allergic reactions to peppermint oil, so if you have any redness of your skin, any itching or a severe headache, that could mean that it's an allergic reaction, so stop the medication.
Yeah, well, I've drank some peppermint tea sometimes and I haven't had a reaction, so I think we should be okay.
Okay, yeah, just a precaution and something to look out for. Do you have any concerns or anything?
No. I think that this might be the godsend.
Yeah. Well, hopefully, and give it a try, and we'll see how that works out for you.
All right. Thank you so much.
No problem.